2 seconds, okay? Okay, good morning. We're recording as well, okay? Can we show our Irina's picture one more time to the camera? How are you? Hello. Hi. If we could just maybe introduce her again, Ina, and just where she's from a little bit and how you know her.
I know Irina for 50 years. She's my childhood friend. And she lives in Kiev. And she's 50. Ира, сколько нам лет? 51 years old. Да, 51. Да.
And can you have her tell you a little bit about the difficulties that she's experiencing now because of the war? And roughly where she lives, not her address, just like the region of Ukraine.
Yes. Ира, расскажи, какие у тебя сложности из-за того, что война сейчас. Ну вот какие возникли с этим сложности? Do you mean difficulties with health or difficulties with life?
With life and health, both.
Вот совсем. Какие проблемы из-за войны, вот совсем, которые возникли? Нету работы вообще. Ира lost her job. Because she was a sales representative, she was selling jewelry in a store. But of course there is... Соответственно, нету никаких денег, никто не зарабатывает. And as a result, she doesn't have an income anymore.
Okay.
Her mom had a stroke. Когда у тебя мама инсульт был? In August. Her mom had a stroke in August, and since then she's paralyzed and requires a lot of medications and diapers and care. So Ira has to lift her. Before the war happened, Ira had a job and she had a sitter for her mom.
Okay.
But now she has to lift her, change her, and wash her. And she doesn't have a sitter anymore because she can't afford it. Neither does she have money for medication for her mom or for diapers. We just spoke about diapers a minute ago. Я говорю, что и поскольку мама лежачая, да, Ира, то ей необходимы памперсы и лекарства, потому что работы нет, оно нет. Her mom's pension is about $120 a month.
Okay. So, as I mentioned to you, and this is always, and one of the things that we're focusing on as we're setting up the CAME platform is that we have a counterpart on the other end that is ensuring that what we're making for recommendations are able to be affected. So again, me telling you to do something you can't do is of no use. And you brought to my attention a few days ago the financial concerns that she has, and I imagine that for so many people in the Ukraine right now, there's no work going on, obviously because of the war, which means it has been 2 months without income. And like most people in the world, most people do not have 2 months of savings to cover their expenses even. And so I imagine...
Потому что, учитывая ситуацию, учитывая то, что там нет работы абсолютно и абсолютно нет денег, и так, наверное, очень у многих людей в данной ситуации, то все, что он будет пытаться делать, оно будет как-то связано с той ситуацией, какая есть на данный момент. Ну, не с теми идеальными условиями, а с тем, которые есть на данный момент.
So we are working, okay, and we will provide financing at a minimum for the medication requirements that she has, and we are going to explore raising additional funds so that at least a few days a week she can get a spell from the house, because I understand from you that she cannot leave the house at all.
No, never been out of house at all for for like a month, more than a month, 2 months now, yeah. Он говорит, что он предоставит деньги, чтобы ты смогла купить лекарства, и также он попробует собрать деньги, чтобы у тебя была возможность нанять сиделку, чтобы ты смогла выходить из дома, потому что он считает, что одна из проблем твоего сердца в том, что ты совершенно не двигаешься на улице, ну, что на воздухе ты не бываешь.
Ну, не знаю, как это даже принять.
She says it doesn't feel...
Почему лекарства не помогают?
Подожди, ну давай же сейчас уже говорить о том, что он говорит. Мы сейчас не об этом говорим.
Ирина, скажи, что это слишком много.
She thinks that it's way too much, help. Well, about with financial help, about getting a sitter. But I said that it's because you think that she needs to be on a fresh air and walking.
I think that two things here, and this applies to anyone who is a family member who has to become a caregiver anywhere in the world. It's very difficult, but I can imagine doing it in the context of what's going on in the Ukraine right now is near impossible to be able to attend to yourself as well as full time almost to someone else. And so
он прекрасно понимает, что как бы быть, за кем-то ухаживать в обычных условиях даже просто очень трудно, учитывая больное сердце и учитывая, что ты привязана, не имеешь никаких доходов, он считает, что это просто такая слишком тяжелая дополнительная нагрузка на тебя.
Because we don't want her neglecting her own health as well, and I think from a mental health standpoint,
что как бы трудно будет тебе ухаживать за собой, если в таких условиях, если ты должна каждую минуту думать о том, где брать, средства, как ухаживать за мамой.
So both from a mental health standpoint and a physical health standpoint, I think it's important that she can get out in small bursts anyways and be able to interact with other people. Hopefully.
Он говорит, что для ментального и для физического здоровья очень важно, чтобы ты выходила, двигалась на улице, и общалась с людьми вне общения только в квартире с мамой.
А если скажи, что я даже с ней не общаюсь, потому что она не разговаривает.
Yeah, she says that even with her mom, she can't really get any conversation because the mom does not have
Right. No, I mean it's very isolating. And does she have friends or family that can visit her?
Он спрашивает, есть ли у тебя семья, которая может там приходить в гости или помогать?
Помогать особо некому.
Not real help.
Семья есть.
Not for help, but just to socialize with her.
She says she can socialize, but she cannot expect help from them.
Okay, perhaps we can work on getting someone to give her a few hours a day, just watching the mother. And it doesn't even need to be someone highly skilled, but someone who could just watch her and be able to communicate with her. If there's a problem, she can come back. But to give her maybe a couple hours to get out of the house, to do some exercise, because
чтобы ты могла выходить из дома и просто ходить гулять по улице и получать необходимое упражнение. Потому что это правильно, да, это часть как бы.
I think we can find some funding for this, because this leads into our medical questions here with regards to her feeling kind of short of breath. And when we talked about this the other day, you and I, Inna, we were discussing whether we think this is from the medicines, from the arrhythmia, or from the fact that maybe now after 2 months of being in the house and not getting out, that she's deconditioned.
Нормально не двигается вне пределах дома, сердечное состояние очень ухудшается. То есть...
Я, кстати, заметила по этому месяцу, что в 1-2 месяцах, что я двигалась мало только по квартире, и мне сердцем хуже.
She said that she noticed that moving just around the apartment and the lack of fresh air, like really.
Yeah, I think that the problem, and I think that we're going to talk about this in a minute. Are you still with me? Okay, I just lost you for a second.
Irina said that she feels that because she moves only around the apartment, it affects her feeling, like she feels much worse and the lack of fresh air as well. Ира, can you turn on the camera? Ты можешь камеру обратно включить? Еще раз нажми на камеру, у меня что-то пропало.
Ага.
Я не знаю, почему пропадает. Да?
So I think
Да, вижу, да.
I think that the problem, okay, from looking at the vital signs that you sent to me today that I just got before this call started, I think that that it looks like we're doing very good with her rate control, okay, and that the feeling of short of breath is more likely fatigue than it is related to her heart not working well or her lungs having a problem.
Он говорит, что он посмотрел на результаты, и ритм, он говорит, у тебя не сбивается. У тебя, скорее всего, утомляемость общая очень повышена. И это влияет на работу сердца. Недостаточно... ну-ка. Yeah, I see. Yeah, I have those guys. Yeah.
Yes. So I had, because this was a question as to, we were trying to figure out whether this was from deconditioning or a medication effect or from her arrhythmia being not well controlled. I asked, in addition to the usual heart rate and blood pressure readings that we were getting every day, 3 times a day, as we're adjusting her bisoprolol, which is a beta blocker, a medicine that helps control the heart rate to keep it from going too fast, and also may have a blood pressure lowering effect. So we're addressing her hypertension, but we're also addressing her fast heart rate.
Он говорит, что все эти лекарства, идея их, что они должны, параллельно замедлить быстрое вот это сердцебиение и понизить давление. But the blood pressure is still high, yeah? Like,
yes, the blood pressure is still high. And remember, I told you we may have to... So I told you that what we wanted to do is we were going to go up on the bisoprolol until we achieved the target heart rate at rest, okay? And that we were seeing that the heart rate increased, okay, with activity, but not too much.
Он сказал, что вот этот пульс, который heart rate, это пульс, который вот внутри эти цифры, да? Он сказал, что она у тебя сейчас в норме. То есть это значит, что сердце даже, оно повысилось у тебя после того, как ты по лестнице прошлась, но так и должно быть. А в состоянии сидя и там просто, оно как бы в пределах нормы.
Инна, ну скажи, что я сердце очень сильно ощущаю. Меня беспокоит второй показатель, потому что первый я не ощущаю. А второй цифры, у меня сердце бьет все время.
She says that she, like, what worries her, it's not systolic blood pressure, but what's the second one?
Yes.
Number?
So the first one systolic, the second one diastolic, just like in the education I sent her from Cleveland Clinic.
Diastolic. What bothers her is her diastolic blood pressure, and she feels it. She said she does feel the heart.
Okay. So when we look at her vital signs, so her blood pressure, her heart rate, and her oxygen saturation before going down 5 flights of stairs and coming up the 5 flights of stairs in her building, okay, when we looked at that, she had a good resting blood pressure, a little bit elevated, but not low, okay, and her heart rate was perfect, exactly where we wanted, like in that range of 65 to 75 at rest. So she should not feel her heart racing, okay, because the heart rate is not racing.
I need to look at the number because I need to.
I can tell you.
But I see. But how about like you see the number 160 over 100 over
Yeah, we're going to address the blood pressure now because I think we've got the heart rate effectively controlled with the bisoprolol. So the beta blockers can lower blood pressure, but they're not the best blood pressure medicine.
Okay.
So
Okay, let me just explain it to you, okay? Сейчас я вернусь. Ирочка, видишь меня, да? Значит, он сказал, что то, что он пытался добиться, вы добились. Вот это лекарство, которое ты принимаешь 20 миллилитров, оно не влияет на давление, оно влияет на пульс. Пульс – это частота твоего, да? Вот пульс у тебя сейчас в идеальной норме, оно 70, ну, такое, ну, как бы в самом идеале. Даже если ты только после лестницы, оно поднялось. Теперь возвращаемся к вопросу высокого давления, потому что вот это лекарство, которое ты подняла до 20 миллилитров, не на давление влияет, а именно на пульс. Давай послушаем. Окей, да, окей.
Okay, so I think that the symptoms that she's experienced are more like fatigue than they are she's not getting enough oxygen. Okay?
Он говорит, что важно, что у тебя есть достаточный уровень кислорода, потому что он посмотрел, что кислородная насыщаемость есть. Значит, на сердце, наверное, влияет вот эта общая усталость.
So I think this is just deconditioning. We need to get her back active and exercising. And I think that if we can get someone to come into the house on a regular basis for a few hours.
От нехватки упражнений и нехватки свежего воздуха, именно ходьбы на свежем воздухе. То есть вот это вот высокое второе давление связано с тем, что ты уже 2 месяца находишься вот в такой.
Надо ходить, да?
Да. She says so you would say that she should walk more.
Yes, she should walk more. But I think that we can arrange for paying someone like a babysitter, okay, does not need a high level of experience to allow her to take a few hours off.
She had one before. It's a very good woman. She was watching your mom.
How much was she paying her?
Ира, сколько ты платила этой сиделке в день? 500 гривен, about $20 a day.
Okay. We can make arrangements for that, okay? So we can do it maybe.
But that was a full day.
Yeah, a full day. Okay, so maybe we can do like 3 or 4 half days a week, okay? That.
Он говорит, что он, например, мог бы оплачивать 3 раза в неделю полдня, если бы эта женщина могла приходить, то есть как бы платить тебе $30 в неделю, чтобы ты ее могла брать на 3 часа, да, там, например, на 3 раза в неделю, чтобы ты могла именно в это время, заниматься, не спортом как таковым, идти просто на прогулку, ходить именно на воздух, не по квартире.
Okay.
She said thank him so much. I don't know what to say.
Can you put her back on the picture so we can see her again?
Can you please, Ира, ты можешь нажать? Опять я вижу. Нажми. Камера. Put your camera on.
Yeah, terrific. Okay. This is something we can do. I told you the other day, we're just waiting on getting her PayPal information so we can make a transfer.
She doesn't have, they do not, the PayPal still does not work for Ukraine, but you can transfer it to me by Velmo. I will transfer to my friend in Germany who has Ukrainian card number. It's how I do help to my friends.
Okay, we'll work it out. Okay.
Мы найдем способ, как тебе передать эти деньги. Хорошо? Продумаем.
Спасибо большое, Ива, поблагодари, пожалуйста, очень красиво.
She's asking, please tell him in English as from a deep of my heart, thank you. I'm speechless and I don't know what to say.
It's my pleasure to help out.
Он говорит, что он с удовольствием тебе поможет. She says it's very unexpected. She didn't expect.
Well, good. This is why I do what I do with my international nonprofit. I mean.
She's very lucky not only get a good doctor, but the doctor with a heart.
Well, I'm glad to hear that. So the question I brought up to you is, so now we need to adjust other blood pressure medicines, okay?
лекарства, которые влияют на понижение давления.
Would there be an ability for her to get laboratory tests now, given the war situation?
Он спрашивает, а есть какая-то возможность сейчас сделать, крови сдать анализы в Киеве? Или сейчас не работают лаборатории?
Я не узнавала.
She doesn't know. She will find out.
Okay. Because it will have an impact. The medications that
She's asking what type of test does she
I'm just going to look at getting a basic labs to look at her kidney function and electrolytes.
Да, это мне тоже делать. Надо электролиты, чтобы и как работают почки. Из-за этого лекарства подбирать. Мне тоже такое делали. Это он тебе, это крови тест. Обычный крови тест на то, что как работают почки и достаточное количество электролита, воды в организме. Ты понимаешь, да?
Ага.
It's a typical test. Ага, ты узнай, хорошо, позвони, работает ли синего. И тоже сколько стоят эти результаты, анализы. She will find out.
Okay, and then she's going to send me, like I requested, her most recent laboratory test before the war.
Если у тебя есть что-то из этих лабораторных крови, анализов до войны, или когда ты последний раз делал, ты можешь нам их переслать?
У меня есть, но это был полтора года назад.
She says the last time she did it was a year ago.
Okay, I'll look at those labs.
Он посмотрит, все равно он хочет сравнить потом. Пришли те, которые есть, хорошо?
Хорошо.
Okay, so her blood pressure sounds like it has historically not been well controlled on the medicine she's on, which...
Он говорит, что показатель вот этого показатель твоих результатов говорит о том, что у тебя не очень хорошо подобран именно лекарство, которое контролирует давление. I told you about this, right before we got on you on a call, that because it's supposed to be stabilized.
Yeah. So she's been running fairly consistently with her blood pressure readings, like what we determined. There's a levels, okay, and I gave that to her in the Cleveland Clinic article in Russian or Ukrainian. She's running consistently stage 1, stage 2, so we need to increase her blood pressure medicine.
Да, нужно будет изменить или увеличить дозу существующего лекарства от давления, потому что тебе нужно снять с этой второй стадии гипертонии.
Но я вот сейчас пью вот эти дни 80 миллиграмм телмисартана, не 40.
She's taking 80 milligrams of millisartan.
Telmisartan, yes, I know. So that's kind of a maximum dose. I think that we're going to add a...
Как можно этого лекарства пить? Больше его нельзя пить, выше дозу.
Да, я больше не пью, да, максимально пью. Потому что не падает.
Let me move to the bedroom because my husband's meeting at work.
Okay.
Я перейду в комнату, потому что у меня у Бена работа началась. It's like this crazy times when everyone is working from home.
Yes, right? I'm calling you from a hotel because I'm on a work assignment. Okay. Okay, wonderful. So yeah, if we could just flip the phone around, I think we can finish up the call a little bit. Okay, great. Maybe just turn that just a little bit more towards the camera, if possible.
Can you see?
Not yet. We're getting a lot of glare.
Light is. This room is worse in the mornings because.
Okay, there. That's good. Okay, we're going to wrap up now, anyways. Okay, so.
But I wanted to ask you because I'm taking losartan and
hydrochlorothiazide.
Together, it works very well. Losartan alone.
That's exactly what we're going to do.
They have it in Ukraine because in the summer I ran out of it.
Yeah.
In my American prescription, I found it in Ukraine.
Perfect.
Я ему сказала, что я принимаю, и он сказал, что да, это очень типичное тут. Оно есть и в Киеве. И сейчас я вас спрошу, what do you think about it?
No, that was my plan. Okay, is to put her on a diuretic, either hydrochlorothiazide or there's another medicine called chlorthalidone that's like hydrochlorothiazide, but maybe a little bit better. They're generally the same price.
Ага, да, это, я принимаю такие 2 таблетки, одна получается от давления, вторая воду сгоняет. Но вот эта, которая сгоняет воду, прежде чем тебя на нее посадит, нужно знать, как работают твои почки. Поэтому ты будешь давать этот анализ.
Okay.
Четко еще. Значит, я принимаю, оставляю 20 бисопролол.
For now, she keeps bisoprolol 20, yeah?
20 bisoprolol, telmisartan 80, okay, and continue the Xarelto.
80 от давления, пока пьешь вот этого.
Oh.
И 100 лексарита, да?
In 100 Lexarite.
What's that?
Lexarite, what is it? Lexarit.
For cholesterol. Yeah, okay. So,
Да, зайчик, это так и оставляешь.
yes, so I'm going to do this. I'm going to send you in writing, okay, a list of the current medication she's going to be taking, okay?
Он мне пришлет, он сейчас составит список всех лекарств, которые ты будешь принимать, со всеми дозами, перешлет их, хорошо?
We're going to start a new medicine, either hydrochlorothiazide or chlorthalidone, whichever she can find.
И он добавит туда вот это мочегонное на английском. Я тебе его переведу на украинский, он есть в Украине, я его нашла. И ты будешь, он совсем дешевый, и ты его будешь, просто добавишь, потому что оно действительно помогает вот этим от давления.
Okay.
Хорошо, спасибо.
Thank you.
Okay. We're going to continue monitoring the blood pressure as we make adjustments in other meds.
Продолжай фиксировать, пока 3 раза в день, хорошо? Пока мы все не установим.
And then I want to see if we can get laboratory done in 7 to 10 days after starting the diuretic.
И он просит, чтобы мы, когда ты начнешь пить вот этот диуретик, да, который мочегонный, чтобы после этого в течение 7 дней ты сделала анализ, 70 дней ты сделала анализ крови, что после этого не ухудшается ли работа почек.
Хорошо.
Okay, so we're going to get labs in 7 to 10 days because these medicines can affect the kidney function and they can affect the electrolytes. So we just want to make sure as we're adding new medicines, we're not causing new problems.
For labs, we would need some paper from you.
I have a laboratory form with HCVI. I can pull out. It's a requisition. And
Для лаборатории форму, что нужно, чтобы ты сделал. Ты когда к ним пойдешь, но они знают, это все одинаковое.
so she'll be able to give it to the lab. The lab will hopefully be able to just send me an email of it, okay? And then I'll upload it to her patient file so everyone can see.
Ты просто дашь его имейл, и они напрямую ему перешлют. Чтобы нам чтобы они не тебе, там ты мне, я ему, а напрямую дашь лаборатории, и они ему просто имейлом перешлют, хорошо?
Okay? So her everything that's transpired between us, all our visits will have a medical note associated with them, and her laboratory test and all her vital signs readings that we've been tracking and analyzing with Google Form and the automatic Google Analytics associated with Google Form. And she has access to that through her portal going forward. So
И мы создадим тебе он создаст портал медицинский, в котором ты сможешь, будут внесены все визиты, которые были, все результаты анализа, все лекарства, и у тебя будет выход в этот портал через интернет, чтобы другие врачи, которые будут тебя консультировать, видели все это, видели курс лечения.
So that will allow her, when hopefully things get back to normal, and sooner than later, we hope, God praying that things get better much faster over there in the Ukraine. But also if she needs to see another doctor, she'll be able to open her portal and share all the information with him immediately.
Чтобы когда вещи вернутся к норме какой-то в Украине, и все заработает, что когда ты начнешь регулярно видеть украинского врача, и тебе нужно будут какие-то процедуры, чтобы украинский врач мог открыть вот этот твой портал и увидеть, что ты делала, в медицинском плане в течение этого времени.
Okay?
Thank you so much.
Okay.
Ирочка, все, я тебя целую, мне надо бежать на работу, детей so much, and she's very impressed.
It's my pleasure. I think very many people around the world are really feeling for the Ukrainian people now and what they're going through.
Все в мире поддерживают очень украинцев и сочувствуют им сейчас.
Ой, спасибо большое.
Thank you.
Дякую.
And I talking to my friends, I think we have great admiration from the courage of the people of the Ukraine and how they're fighting back.
И он говорит, что он вчера как раз разговаривал там со своими военными знакомыми, и что они чувствуют такое чувство очень уважения к военным украинским тоже, которые, ну так, мужественно.
Да, это
Yeah,
действительно
we
они
also
лучшие.
say like they're very. I feel very.
I just missed you a second. Can you just say that one more time? We had a freeze on the internet.
I spoke with you about our fighters like yesterday, and they do really hold up very well against.
Okay.
It's very difficult.
So I will probably make an effort to see her, and because I'm traveling, I can get medicine inexpensively in the United States. I'm delaying my flight. I was originally going to leave on Thursday, but I'm still collecting medications and supplies.
Он сейчас собирает лекарства и всякие вещи. Он уедет в Украину, он должен был лететь на следующей неделе, но там задержка с лекарствами, которые ему обещали.
Yeah, so the order that I'm putting together is now over $150,000 donation.
Ого. А то он говорит, что он с собой потом должен будет в Украину привезти на там вещей на 150 тысяч долларов. Там люди дали всяких лекарств и для украинцев, которые он будет с собой везти. Ну, их надо все собрать. So when do you think will you go?
I'm looking at airfares right now. The rate limiters, I've got one big shipment that they're going to tell me today when it's going to arrive. If it arrives on Thursday, I leave on Friday. If it leaves on Friday, I leave on Saturday or Sunday.
This week.
This week.
Oh my God, он уже на этой неделе едет в Украину. Так вы увидите скоро. You'll see. I'll translate you maybe in personal meeting. I have a friend there who can translate for you.
Yes, perfect. So I'm going to be bringing her medicines from the U.S. for a year.
Лекарства, Ира, тебе из Америки. Он твои лекарства привезет тебе из Америки. Уже к концу. Thank you.
Okay, and I'll get the same whatever medicines her mother is taking as well. We'll purchase those for a year.
У нас снят список лекарств, которые принимает мама, и пришли. Он попробует их тоже привезти. Thank you so much.
Yeah, so when I get there, I mean, I've got a couple defined roles right now. I'm going to be working with another NGO on the ground, and the hospitals are receiving patients from the battle zone, and I'm going to be setting up pre-hospital, advanced triage and transport, where we're going to have mobile units, ambulances that are going to have. Right now, they're mainly been doing just transport.
Where will you be? Like what area?
I'd rather not disclose that. Yeah.
Он не может сказать, где он будет, но они будут создавать такие мобильные госпиталя, сеть мобильных госпиталей.
Yeah, so even though we would like to tell the story well of what's going on over there, obviously we have to be pretty sensitive to the security issues surrounding this.
Да, он говорит, что он не может отвечать на вопрос, где они будут. Ну да, я не знаю,
Okay.
что происходит.
But we think that by doing a few things, so right now it takes maybe 30 plus minutes to get from, wherever the injury took place, to the edge of the battle zone, which is called the yellow zone. It's like a buffer zone where the patients are being picked up. At the present time, they're just transporting them. But we think some simple interventions, if we can train the advanced providers and to be doing airway management, some additional stuff with hemorrhage control and wound management.
Планируют обучать украинских медиков, как те, которые там на поле боя, что как можно оказывать такую сразу помощь, чтобы не надо было даже не перевозя оказать хотя бы первую помощь, потому что иногда человеку приходится там 30 минут довозить с момента.
And then hopefully we'll get the patients better prepared. We're going to be giving them a medication. I just purchased 1,000 doses of it. That's if it's given within 3 hours of major trauma, decreases mortality from bleeding by about 30%. One dose of the medicine will do that.
Он говорит, что они сейчас закупили 1000 лекарств, которые помогают, если его вколоть в течение часа с момента раны, то очень сильно есть вероятность того, что человек выживет, потому что оно кровотечение очень уменьшает. That is amazing.
Yeah, we're going to be introducing some advanced practices, and that second 30 or 40 minutes from that yellow zone to the hospital is kind of the death zone. So if nothing's taking place from a treatment standpoint, we have a lot of complications, including death. And some simple, although requiring some advanced skills, some directed interventions, both before we load the patient in the ambulance and while we're continuing the patient in the transport, including potentially giving blood. We have not enough, but we're looking to get more of these hemoglobin monitors by Massimo, which I've been using for a number of years to allow us to rapidly get an assessment of anemia or blood loss without taking blood or using a laboratory. It's with the pulse oximeter. And it's a great technology. We've used it very effectively in our blood donor programs as well as preoperatively.
И они пытаются доставить вот эти машинки, которые будут, там уровень, чтобы было видно, сколько у человека падает, количество крови, как он, кровотечение. Доктор, is it okay if I let her go because my phone is on loudspeaker?
Yeah, sure.
Ирочка, пока.
Okay, bye-bye. Okay. Okay, great. Yeah, perfect. Okay. So. Okay, I think we can get her, like I said, the health issues under better control, and I think that like when I talk with you, I think we've kind of resolved that the issue's not really the medicine or not really her heart racing or anything like that. I think it's related to the fact that she's had 8 weeks of not really leaving the house, and that's a big difference in your conditioning. And so I think if we can get her doing short bursts of exercise during the day, even leaving her mother for 5 minutes to just quickly walk up and down the stairs and then come back into the room.
Yes, yeah, thank you so much.
Okay, so I'll give you a written summary of the plan. Okay. And we've been using Google Translate with this, and I translate it for you into Russian.
Yes, perfect.
And you said that it had a very low error rate, correct?
Yeah, it's not bad. There is a great, if you ever want more precise
Mm-hmm.
for me, but I don't know how good it is with medical terms, but just if you ever want a great one for your future, it's called, oh gosh, what is the name of it? Smart Cat.
Mm-hmm. Yeah, I'm familiar with some of the other platforms.
Because I do everyday briefings for Minister of Defense.
Right.
It's so far the best one in terms of terminology.
But you have to pay for it.
Yes, maybe like if someone can pay like for your, I use my friends, but.
Yeah. Shh. So again, there's a balance with a lot of things. And one of the reasons that HCBI, Healthcare Volunteers International, my organization, is focused on developing our ecosystem almost exclusively around Google is the fact that 85% of the world uses Chrome browser and uses Gmail, and all these things that we can use, extensions developed and verified for security by Google for free. Again, my dad likes the phrase, the enemy of the good is the best, and so unfortunately, when you're looking to deploy things in resource poor countries, and then compound that with language error, issues, I think that you need to have something that is simple and capably used by the people on the other end. And I think that as a consequence of so many of the things that are available through that Google ecosystem to anyone who has a Gmail and is using their workplace, and I think that it allows a great degree of easy collaboration between, healthcare providers as well as the patients, and allows for a much smoother interaction without taking cost away that could be used for purchase of medicines or supplies. Because always, I don't think you're going to find a nonprofit who doesn't say that they could always use more money. you know, because there's certainly more people like your friend, and we'd like to help as many people as possible. But as you know, what drives a lot of these things is financing and funding. So, we're hoping that with this new need in the Ukraine, that people will develop a sense of empathy for what's going on over there. And those of us who are so blessed here to not be experiencing this, that will feel some degree, that they want to, be a part of the solution, and feel that they can help as well, and that they can be empowered, in that way to have an impact on the outcome of what's going on in the Ukraine right now. Because
thank you so much for helping.
Yeah, I think how the global community responds to this is going to determine how long this goes on, and I do believe though that the Ukrainian people have shown that they're going to win this no matter what.
But yesterday I got so upset because I was I have claustrophobia. Yeah, I could never go to a bomb shelter. I'd much rather die from shelling than go even for an hour in a bomb shelter. And yesterday I was watching this video. The guy in Mariupol, there's so many kids underground. He showed they say, oh, we are trying this. The Azov, the division which is underground of Mariupol, yesterday they showed a video. They're hundreds of kids aged 3 months to 12 years old who haven't been out for 60 days. They're in catacombs, and they're begging for the green corridor that they would let them out, the kids out. Not the men, not the fighters, but the kids and their mothers. And they live there. It's terrifying.
I think that it's hard to put yourself even in the shoes of the people over there. There's no one in any Western country who's experienced that degree of threat to their well-being, and it's just something that, like I said, I've never ever experienced that, and I've certainly seen, some very destitute situations working globally for, my whole career. Particularly, after the earthquake in Haiti and stuff like that, you see some awful things, but, this is just.
It's with natural disasters, you don't have anger that someone intentionally ruining.
No, I think that.
As humans fight against natural disaster, but when you think that there is an evil guy who sits and gives directions to just kill people, yeah.
Oh, it's just horrifying to entertain, and I thank you both for kind of sharing this experience, and hopefully it'll touch people, and cause them to pause and think about what's kind of important in life. And
really, imagine she already honestly talking without her being here. So she already had situation when she had bare minimum for her pay. Her pay was $300 a month, so $400 a month, and that was barely enough to pay babysitter for 3 days a week. She worked 3-day shifts, and 3 days, 4 days she stays with your mom. 3 days, 4 days. And but she could manage it, and she had to pay for the bed she borrowed from. It's $50 a month, like a bed she pays for her mom, medical bed. Then she pays for diapers. She pays for all these medications. She couldn't afford the guy coming for physical therapy because it was $60 every time he'd come for a visit. But she did 3 times, but then we quit. But then she barely could do this and feeding herself. And then suddenly, on top. So she loses her job, any source of income. Yeah, all the bills continue come, like electricity and stuff like this. And I do help her financial, but I can't also take much of a responsibility. But
Yeah, I think that people can understand. I mean, how easy you can slip from getting by to not being able to get by.
not being
There,
able to get
it's often not a big wall to climb over, or you can be walking along that cliff's edge and doing okay, but it's just a small bump, and all of a sudden you're doing pretty horrible.
And then, of course, there are a lot of help here, like even we send diapers and stuff like this. But when it comes to here, it goes to most needy areas, and Kiev at the time is not considered to be the most needy area. Yeah,
Mm-hmm.
they say, okay, people there can go to the store and buy diapers,
Mm-hmm.
but if you have
Mm-hmm.
some kind of, I don't know.
Yeah, I'm going to so regarding her mother, we can address this later, but I think that we could maybe have one of the HVI physical therapy people get involved with showing her some exercises and some range of motion she can do with her mother in the house.
Yeah, the guy did it. She does, and even like in hospital, they told that your mom will be completely, how do you say it, vegetative.
Yeah.
No,
Mm-hmm.
no, she recovered to the point like they did some exercise, like her left side is working.
Yeah, so when I get in country or through a video call, I'd like to meet her in person, and I'll make some assessments, and we'll make sure that we're focusing. The big problem in people who are not moving is preventing bed sores.
You fly. The reason I was asking when I fly because I want to go to Kiev and I'm trying to find a good way of getting there.
I,
But it takes. What's your? Do you know your route? Like if
they're
you
telling me that Krakow's probably the best to fly into.
Krakow, yeah.
Have you heard anything different?
I heard Warsaw. A lot of people go through Warsaw. But I just read like Washington Post report. If you want, I'll forward it to you.
Okay.
It took him 5 days from Washington D.C. to I don't know where you're located to Warsaw, then to some town. He names everything. I can send you.
Mm-hmm. So I mean, the some members of the team are going to meet me at the airport.
Okay.
I'm going to go directly that night to our camp, or our our area of
If you need a place to stay in Kiev, I have an apartment there. Yeah,
Okay, yeah, that's wonderful. I again, as my details come together, like I said,
you can always stay in my apartment.
awesome. That would be fantastic. Like I said, the there this is a very kind of fluid environment, and everyone's kind of figuring out what to do, and getting better at collaboration and working together. Like I said, I'm as a representative of my organization and bringing a lot of the things that we've developed over the years into this. Um, you know. Uh, is an opportunity for organizations to kind of take what they do best, and learn from the other organization of what they do well, and hopefully we can get some synergies, and provide some benefit to the people over there, and to minimize the suffering, and the consequences, including death, of what's taking place there. So we hope that this is a good. I think it's going to be a very good partnership with the organization I'm going to be working with, and taking kind of some of the knowledge that we bring and pairing it with their knowledge of dealing with refugees, and all those issues that take place with people who are displaced. And frankly, even the people who have not left Ukraine are sort of internally displaced now, in the sense that they're stuck where they are, and they're out without resources and income, and access to food, and all these things that you would think of being in a refugee situation, is taking place to people who are still in their homes almost.
Yeah, I'm running a little project. It's for teachers in Ukrainian villages to learn English, and I was running before the war, but now we just like with volunteers from America. Now we just get like twice a week and talk, and they tell their stories. Yeah, what's happening. And like one woman, she's from tiny village, and they hosted like about 25 people a day.
Mm-hmm.
So the people run into their village, and it's like everyone is confused. Like those people lost their homes. Those people who live in this village are also like the village is not meant to host like people coming, and there was one businessman who had like those trucks, big food trucks. They turned it into mobile homes for
Mm-hmm.
people to stay. It's like and they like said that yesterday, last time she didn't come to class, and she said, "I'm sorry I didn't come to class, but we had a group of people who got under shelling and two cars exploded. There's a kids killed. It's like unbelievable." What they do to Ukraine, and I don't know if you ever seen Ukraine. Like I'm serious. Like I've been like last October in Kiev because I go like 3 or 4 times a year everywhere. And I thought it's this place becoming cooler than New York because my daughter lives in New York and Kiev. I looked at Kiev objectively and I said it's becoming so cool. There's so many cool places like cool concerts, cool art exhibitions. Like honestly, medical care became so much, but not in entire Ukraine, but even in Kiev. Like my dentist was amazing. I don't know what's happening
Mm-hmm.
once again. Like poor guy, he just rose to. I have a same dentist for 20 years. Eventually, he established his own clinic. He was so happy. All of it. Where is he now? I don't know. Like everything was so cool, and
Mm-hmm.
it was like envy of a fact that we wanted to live better than.
Mm-hmm. So we were going to talk for a few minutes about some of the cultural stuff related to providing healthcare remotely, and maybe just as an introduction, if you could just kind of state who you are and what you do and how you got to the United States and what your current connections are with Ukraine.
So I am. My name is Ina. I'm this American Ukrainian, Ukrainian American. I met my husband, who is American, in Kiev 29 years ago. He was teaching English. He was my English teacher, and well, we started dating. Eventually, we got married, and I have been living in United States for 29 years. Out of these 29 years, though. 7 I lived in Ukraine straight, and then a year here and there. Right before COVID, I went to volunteer in a Ukrainian village for a project to teach language. I've been there like for 4 months before COVID started. Then I came back to America and then went back following autumn for another 4 months. So then usually I go to Ukraine to visit. I have my family there, my very close friends. I go like twice, 3 times a year, and I usually spend the summer there. Also, I was running a magazine for Americans called The Ukrainian Life and Culture, trying to show Americans what Ukraine is, contemporary Ukraine. I was doing it for 3 years. And now I'm running a project called Silo, which means Village for Ukrainian Teachers, to communicate for free with Americans that they could see how actual English and facts function.
Mm-hmm.
So, medicine was the biggest shock for me when I came to America, and biggest cultural difference
Uh-huh.
in various degrees of pluses and minuses. And you will see, so in Ukraine, there is a very good therapeutical medicine. I don't know if it brings any good to your body, but it definitely brings good to your soul.
Okay.
And there is very bad diagnostics and very bad, it could be good surgery or bad surgery, you never know, but it's a very bad after surgery recovery protocol. A lot of people get complications and they do not recover well after surgeries. Now, the problem for Ukrainians when they get to United States is they meet American doctor, and for American doctors who get very confused. So Ukrainians generally believe that the chronic disease which sit in you, and they get periods when they get worse, and it's usually spring and autumn. And I was once in a emergency room. I was alone in America, and I was like in emergency room, and I heard the guy next to me talking to an emergency doctor. But what's wrong with you? Well, everything is sharpening, and like I hear the accent and I know exactly what he means because we call it spring sharp. But the doctor, but what hurts? He says everything: liver, bones, like kidney, and heart. And the doctor probably thought that he's mental. So eventually, I said, "Can I explain? It's what we think." So we believe that the chronic disease, which can be treated by putting you in hospital on IV through some magic liquids which go through your body and make you feel better. And when Ukrainians don't get this type of treatment, they get very suspicious. Like the doctor does not care about me. They either so, and of course a lot of folk medicine prevalent over medications. Yeah. They are like, because I'm a folklorist, I even seen people going to, like, instead of treating epilepsy in children, they would go to like a witch, village witch, and pour egg over with the words. Like, but that's extreme. But they expect, like when my son had sinuses problems in Ukraine, we went to a doctor, and doctor sent us to a place where they would put silver, they called it silver treatment.
Right.
Like rinse the nose with whatever silver liquid. And
no.
In America, they either suggested, they said, well, it's a cold. What do you want? I said, well, I want to rinse it. They said, well, take a water and rinse it. I said, no, but where is a special place?
Yes, I understand this. As you know, I've got an extensive amount of experience, and I've worked in Africa and Southeast Asia and the Caribbean islands and all of Latin America, and there are a lot of unique things, particularly when you're dealing with people with lower levels of education. A big thing, like in Cambodia, is they put these like pieces of tape on their forehead, these fever patches. Do you know what I mean? Even when they don't have a fever, but they like, and the common phrase in Cambodia is, what's the problem? No power. Doctor, I have no power, and that can mean, it can be, I don't know what it means, you know what I mean? So you then spend the next 10 minutes trying to figure out what this broad term, no power, means for that patient at that moment in time, because they may come to you a month later and no power may mean something completely different, And
then you've got to remember, you've got to know a couple of very important things. We do believe, and nothing will stop this belief, so don't fight.
No.
That if window is open and air is blowing, it's bad for your head. You're going to get a head cold.
Yes.
People do not, any cross breeze is bad for you. On a buses, I was on a buses which would run for 5 hours without air conditioning, all the windows would be closed. Because as soon as you try to open it, people say that cross breeze cold. They hate air conditioners. Majority of people hate air conditioners. They think they cause lung problems. And they, so those things they just believe, especially the cross breeds, and they do believe that cold ice or cold water will cause you sore throat, and going out with wet hair will cause you meningitis.
Yeah. I've encountered the same type of thing, and I've learned that there's no point whatsoever to be battling these things, and trying to apply science to it, because it doesn't work, but it does do what you said. It makes them suspicious that you don't know what you're doing, that you're not doing these things that they've been told by their mother to do, their grandmother to do, and they've been doing for decades. And that now you get some guys saying that doesn't work. I think that again, it's hard. I think bringing education in is a slow goal. Do you know what I mean?
And then once again, like those drippings, they put people on IV like for heart condition.
IV for everything.
Like my mom and my grandmother both died from heart illnesses, and but they would go every spring through this 10-day of whatever it was. They would put in an IV until live for 2 or 3 hours.
Yeah.
And it's much more. It's more therapeutical. At the same time, it's less now. It used to be a very cruel medicine, and people are used to it because, like, my appendicite was taken out without any anesthesia. So I got an anesthesia for cut.
Yeah.
Nothing else. So, and because they thought that back then they thought anesthesia is bad for you, general anesthesia.
Yeah.
Maybe it was bad. I had few nerves taken out from my teeth without any anesthesia.
Yeah. So
it's this type, and at the same time, it's like in America, it's completely different attitude. So my daughter, for example, I'll give you a good example. My daughter has a scoliosis, severe scoliosis. She was diagnosed in Ukraine when we were there, my older daughter. And the doctor, we went to a doctor and he said, well, it's a huge problem. Your childhood is over. She either will have a cast, like to hold for 24 hours a day, which is awful, or surgery, which is very risky. And it's like basically the end of the life. So, and I said, okay, I'm going to America. I will get the consultation. Then the guy told me, if the doctor in America says anything different, let me know. So, and I went to American doctor and he said to me, yes, Carlos, that's okay. Well, we will make a cast, so what? She can do anything in it, play volleyball, sure, yeah. And yes, surgery, you can do surgery, but I wouldn't worry about surgery right now. So everything was so positive. When I went to Ukrainian doctor, it's like the end of the life.
No, I've seen that before. And I think that part of this is it may be the case in that country that they don't have the resources or knowledge to do these things. And as a consequence, you get a different prognosis, than, but I found recurrently there's this magical thing with getting an IV.
Yes. And another thing, like imagine, like there's another big thing about mentality. Our doctors don't tell patients that they have bad cancer. They don't. They tell their
tell the relative.
The relative decides, and I have few friends who decided like not to tell their parents they have cancer, even if they found out. Yeah.
Mm-hmm. No, I think that there's a lot of things that
you freeze. So just freeze for a minute. I have friends who made a choice not to tell their parents that they had cancer, because they thought, what's the point? They have few months to live. If the doctor says at the last stage we can do this, or not do nothing.
Right.
But it's in America, doctors never share it with your relatives, they share it with you. In Ukraine, they think it's too dangerous to share it straight with a relative, with a patient. So that's a big difference. Like
I think that's common, I think, in many countries. I mean, there are very significant differences between the cultures. And like I said, I think there's expectations that we have to recognize on this side that it's not worth battling against those expectations, but that we work with them and then we add on the things that we know are going to make a real difference without going ahead and removing those things that are not making a difference. One of my favorite pictures with the IV stuff is at the Children's Hospital of Cambodia, where I swear to God, you couldn't make it into the hospital without having an IV. Do you know what I mean? Like everyone gets IV, and I have a picture, because I have a little playground in the kind of central area in between the buildings. I've got a picture of a boy standing on top of the slide going down with his father holding his IV pool while he's going down the slide, and he has a Coca-Cola in his hand. So he's drinking, no problem. He's out running around the playground. The father's chasing him with the IV pole, and the kid's going up and down the slide, but the doctors felt he needed an IV. And God forbid that we say that you don't need the IV, because then the parents are going to go, oh my God, this doctor doesn't care about us. He won't even give us an IV. So I think that sometimes what I've learned to do with this is you just say, hey, all right, we'll put an IV in. Do you know what I mean? No major harm is going to come from it, and if it makes them feel better about the process and enables me to give the right medicines and do the other treatments with confidence. I think that that's an important point that I think you make, is these cultural things that we may have a scientific, kind of basis to say that, it's not going to work, is better off just kind of keeping your mouth shut.
Because I think partially, from what I learned from my experience, that partially what works if patient is optimistic about the recovery and if he trusts in a doctor. That's the bond between doctor and a patient is probably halfway to recovery. Like even if it's not, it's still better than a suspicion, which would be a
No, I know. I think that if your patient doesn't trust you, and this is true anywhere, in any context, I think you need to figure out what buttons need to be pushed to enable that level of trust to develop between you and develop a relationship with the patient where they feel that your subsequent recommendations are valid and that they're going to, that you're interested in helping them and getting them to better health. And I think that, like you said, I think that's a very good point to share with our doctors as they start doing the telemedicine there, to understand that it's probably not in their best interest to, in their best interest to be
yeah, you can just add, like, if they say, if the patient said, but should I gargle whatever with, if it doesn't harm, you can just say, yeah, you can add it on top of
yeah, right. I think that's a great way of putting it. Take whatever they're doing, as long as it's not harmful. It may not be helpful, but as long as it's not harmful or terribly expensive, to just allow that to continue and then do the things that you want to do as an add-on to those things that they believe are very important as well.
Yes, yeah, the important thing to say, and they figured out in a combination with these drugs, this thing works 10, 20 times better.
Yes, exactly.
Drinking hot milk with raw egg and butter.
Well,
in a combination with antibiotic kills the strep throat much, much better.
Wonderful. Well, I know you've got to get to work, and I appreciate you taking all the time to do this. And we're going to continue, doing these things. I'll be sending you.
You need my help. If you're in Ukraine, you need translation or my help or something.
Mm-hmm.
Give me in advance.
Perfect. Yeah. No, I appreciate that offer. And I will be sending you an email shortly with a summary of what our medical recommendations are. I'll use Google Translate to translate them into Russian to make it easy for you. And again, this gives me some reassurance, in that platform, because obviously I can't tell whether it's translating accurately or not. But it's nice to see that, when we've been discussing some fairly in-depth and medical stuff with medical terminology, it seems like it's been pretty good.
Yeah. Yes. Okay. So please stay safe if you go.
Yeah, I'll talk to you beforehand, because we'll probably be addressing some of these things, and then once we figure out when she can get her labs drawn, I'll probably be in Ukraine then, but the internet's working over there, so we'll be doing a telemedicine call, except I'll be over there. Okay.
But take it. Be very safe in Ukraine.
Yes, I will.
Mm-hmm. It's a wonderful place, but now it's a bit dangerous.
Yes. Okay.
We'll keep in touch and talk to you soon. Okay.
That's wonderful. Thank you. All right. Bye-bye.